Well, you just had another anxiety attack.
And Entertainment Weekly said I wasn't consistent.
Today we're tackling a brand new show, BoJack Horseman. If you're like me and have never seen BoJack Horseman, the series follows a 90s sitcom actor lost in a sea of self-loathing and booze, all while trying to restore his Hollywood career. Sounds super interesting for sure. Plus, we're going to be learning about and breaking down some of the crazy medical type situations and injuries that happen in this show. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an ER doctor. If you enjoy the educational reaction videos and other stuff you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
I can't breathe. Am I dying? Toast! I smell burning toast!
Oh my God, my toast!
There's different reasons why you would pass out. There's like a vasovagal event that occurs. It has to do with how much blood flow or lack of blood flow goes to your brain. Or is it from a heart arrhythmia where you're getting a pause or a funny rhythm, not getting enough blood to the brain? And horses have a much more acute sense of smell, so it actually probably hit this horse really intensely.
On my grave, I wanted to say that I was born in 1970.
So I don't know exactly what's happening. The horse is talking, so they're now awake now. So the syncope or the pass out event has already occurred. Oh, look at all these arrhythmias.
Well, we did everything we could. Nurse, record the time of death. It doesn't get easier.
If he was alive, that rhythm is called bradycardia. If he's not alive without a pulse, it's called PEA, pulseless electrical activity. Then he went into this weird rhythm, which could be a sine wave, or it could also just be VTAC or VFib. And then they never even checked to see if he had a pulse. They just looked at the monitor. You know how many times monitors are wrong? So check your equipment, check the patient, and then move forward.
That's right, sweetheart. He died of a broken heart because you didn't appreciate him enough.
Doctor, come on, that is wrong. There is something called broken heart syndrome called Takotsubo's cardiomyopathy. They're actually changing the name. It's like somebody having a heart attack, but there's no actually blood clot. It's actually due to emotional stress. Pretty crazy.
Well, BoJack, it looks like what you experienced was a mild anxiety attack.
Jesus,
Yep.
if that's mild, I don't want to know what spicy feels like.
If somebody's having anxiety and they say that they're gonna die, we take it really seriously. So we first make sure that they're not actually gonna die. If our suspicion is high of anxiety, we'll also give an anti-anxiety type of medication to calm things down. And then if hopefully everything is negative, then we can get the person home, maybe follow up with a psychologist, psychiatrist, and start on a new medication. There's multiple reasons why people have anxiety, and you gotta get down to the root of it.
You've been overstressed. I need you to take it easy.
Take it easy. Are you kidding? He doesn't have a job. He has no real responsibilities. He doesn't do anything but take it easy.
So all of those reasons cause a lot of stress, and so that can bring on anxiety and stress and panic attacks.
Take it even easier.
I can try, doctor. I can try.
Well, you just had another anxiety attack.
And Entertainment Weekly said I wasn't consistent.
Typically, anxiety attacks aren't like that. They're short of breath, chest pain, feel like you're gonna pass out. Treatment for anxiety should be behavioral changes. That's like your number one, but that's very hard to do and it's anxiety provoking. Medications that a physician can help you with are ones to help with panic attack, and then the other one is an anxiety depression medication. Always continually try to work out the root cause of your anxiety as well as how you handle anxiety when it does occur. And at the end of the day, physical activity, good nutrition, healthy sleep will do loads of help to help with anxiety and depression.
Just need something to help me focus.
Focus. A lot of times focus is just related to good sleep. If you're not awake enough and you're super tired, you're not gonna be able to focus very well.
Coffee.
Yep.
No. Cigarettes. No, tequila. No, I just need the right music to do drugs too.
Oh my gosh. Holy cow. Coffee is a stimulant, can keep you up so you can try to focus, but a lot of times people just get jittery. Then cigarettes, people do that to calm down. Nicotine, but nicotine is actually also a stimulant as well. And then we went alcohol. Alcohol is the depressant, so it's not gonna make you focus. And then chill music could get you in the right mindset to turn off everything else. And then BoJack just went way out in left field and just started doing drugs instead. Okay, all of those things, no, they don't work.
These are gonna gonna help me focus and get work done, right?
Oh, yes. These are what I give college students, so when they come to, their term papers have written themselves.
Oh my gosh. What they're talking about is another type of stimulant, which is usually used for ADHD, ADD, basically Adderall, Ritalin. But if you take them and you don't need them, they're just going to get you all like jittery and uncomfortable, and you're not going to be able to focus anyway.
I want you to take 3 of these every hour and take 2 of these every half hour. Whatever you do, don't take more than 4
Oh my gosh.
every 90 minutes. And take the first 2 of the 3 before you take the second 2 of the 4.
Now that girl needs to go to the hospital and get her stomach pumped. Do we know what stomach pump means? Well, there's 2 things you can do. Activated charcoal, depends on the type of medication that you're overdosed on. It helps bind it so then it's not absorbed through the body. You can do whole bowel irrigation, where you actually give a specific type of medication that makes you have massive amount of diarrhea to get everything out of your system. But do not take more than what is indicated on the bottle or the prescription. There are detrimental, harmful side effects that can occur if you're taking the medications the wrong way.
Well, I'm off to perform child heart surgery. Ugh. Wish me luck.
No, oh my gosh, the doctor's taking his own drugs. This is horrible. Bad doctor, house call doctor, just giving drugs willy-nilly, and literally the person sitting in the chair just took them all anyway. And now you're gonna have potentially seizures, cardiac arrhythmias, stop breathing, all different types of overdose mechanisms could occur.
Good news, the results are in.
Oh.
Bad news, the results are bad.
Oh man.
Mongoose Convention, you are running dangerously low on eggs.
How many do I have left?
So looking to try to see if she's fertile, depending on the eggs. And then also you always want to check the guy and make sure that the sperm is enough volume to make sure that it actually could fertilize an egg.
Well, let's just say it's more than Harry Potter movies, but fewer than James Bond movies.
Doctor, no.
What do you recommend?
Have you considered impregnating a younger woman?
That's messed up. That is so messed up. So you could do a surrogate, but not impregnated. That's horrible. You can do in vitro, in vivo. There's all different ways to actually have the egg and the sperm meet together, so to speak.
No, I want to do it with this woman.
Well, you could try throwing money at the problem. You're going to want prenatal vitamins, cervical mucus boosters, a You Can Do It poster, and an iOvulate. This state-of-the-art bracelet tracks your cycle and also gives you up-to-date info on your ovulation. Plus, it's voiced by Harvey Fierstein.
Hello, I'm Harvey Fierstein.
Look at the watch. It's like the anatomy of the female organs. It's actually quite funny and pretty accurate. So it's got the uterus, fallopian tubes, and the ovaries. The reason why there's a watch to tell you when you're ovulating, because you can't get pregnant every day of the week. It's not possible. Or you can't get pregnant every day of the month. There's a specific time window when the egg gets released from the ovary that a sperm can then fertilize it. You know, this is why you monitor your temperature. That's why you have this ovulation watch. These are things to get you more narrowed into the exact time of when you ovulate.
Why are we at the pediatrician?
Oh, we're
Trust
at the
me,
doctor's
this doctor
office.
is the sleaziest, dopiest, scurviest of the scurvy.
Who is he?
Exactly.
Who wants to party?
Oh my gosh.
Doctor Who, thank you for squeezing us in.
You always gotta make time for your friends.
I'm trying to get my hands on some Feel Betterin.
Feel better.
Feel better.
BoJack, have you been taking oxypraxil cortisoid?
Yeah, I know what you're thinking, but I
my
legitimately have a herniated disc.
He's telling the truth. I threw out his pills because of my trauma from when I got drugged by his mama.
A lot of times doctors won't refill prescriptions that have that type of story because there's such a high level of abuse. Now, if there's a police report stating that your house was broken into, something was stolen, you reported it, it's a different story. A lot of times people try to abuse the system and to try to scam doctors and pharmacists to give them more medications.
Okay, do you know how many times I hear this story every week?
This story specifically.
I don't know who you think you're fooling, but this who won't get fooled again.
There's a whole opiate epidemic that's going on, but we don't really talk about it very much right now because there's a whole other pandemic that is going on that's got everybody's attention. People get addicted for many reasons to opiates. But the issue ends up being you get so desperate for the medications that stories are made up, injuries are made up, anything possible to get medications. And there are red flags all over the place at hospitals, doctors' offices. Obviously, if you're abusing these medications, there's also different avenues to get help if you want to get off of these meds. This is pretty funny. BoJack Horseman, I liked it. It took me a little bit to get used to the horse talking and all these animals talking. We definitely need to check it out and do another video. Let me know in the comments which episodes I need to check out. Do you have a favorite TV show or movie that features medical situations that you want me to break down further and explain? Let me know which show or episodes in the comments below, or if I missed any BoJack Horseman scenes that I should check out for another video. As always, make sure you subscribe if you want to see more fun videos like this one And check out my Doctor Reaction series right here to catch up on all the reviews of your favorite TV shows. Thank you so much for watching and stay healthy, my friends.